Namaskar and welcome to our special series on Eye Matters Daily. Did you know that glaucoma is one of the leading causes of irreversible blindness? It is estimated to affect around millions of people in our country. And what's more concerning is that most people don't even realize they have it until significant vision loss has occurred. Today, we'll be talking to an expert to understand what glaucoma really is and why early detection is so crucial, and how you and your loved ones can take simple steps to protect your vision. So let's get started and shed some light on this silent thief of sight. Doctor, recently I've been hearing a lot about glaucoma and how it silently leads to blindness. Can you help us understand what glaucoma really is and what are the most common risk factors leading to glaucoma?
So, hello. Glaucoma basically is a chronic, progressive, irreversible damage of the optic nerve. The optic nerve is the nerve responsible for vision. Hence, glaucoma is usually called the silent thief of sight. Why? Because the disease slowly progresses without much symptoms. Hence, it goes undetected. And like you asked, what are the common risk factors? The risk factors include increased intraocular pressure, family history of glaucoma, systemic conditions like hypertension and diabetes, chronic use of steroids, or conditions like high myopia. Hence, a regular checkup is very important, especially after the age of 40, even if you do not have any symptoms.
So if I'm diagnosed with glaucoma, what are my treatment options, and will I need surgery immediately or are there any alternatives? Also, does the treatment differ from the type or the stage at which glaucoma occurs?
Okay, so not everyone with glaucoma needs surgery right away. In fact, most patients are initially managed with eye drops that help reduce the eye pressure. If needed, oral medications or laser therapy may be used. Surgery is usually considered if these measures do not control the disease effectively. The treatment plan depends on the type of glaucoma. For example, there is open angle glaucoma versus the angle closure glaucoma, and also how advanced it is at the time of diagnosis. The key is early detection so that we can start the treatment with less invasive treatments.
I've also read somewhere that there are certain simple signs like eye pain or increase in spectacle number that could be the early signs of detecting glaucoma. Can you help us understand these symptoms better?
That's an excellent question because glaucoma can be very tricky. In most cases, especially in open angle glaucoma, there are no obvious early signs and vision loss happens very slowly. Let me explain. Basically, in glaucoma, there is a loss of peripheral vision, whereas the central vision remains intact. So, in such cases, the patient does not realize the gradual loss of vision, as the central vision is obviously not much hampered. And that's why a regular checkup is also very important. However, in some cases, especially in acute angle closure glaucoma, people may experience severe eye pain, headache, blurring of vision, halos around the light, nausea, or a sudden dip in vision. A frequent change in spectacle power isn't a classic sign of glaucoma, but it could hint at some other eye issue. So, any drastic change or sudden change in the eye or the vision should not be ignored and should be checked by an expert immediately or as soon as possible.
Another question I wanted to address today, are there any other comorbidities like diabetes or hypertension that could lead to glaucoma? And are there any precautions that one can take?
Yes, having diabetes or high blood pressure or systemic illness can increase your risk and make glaucoma management more difficult. These conditions can affect the blood flow to the optic nerve and worsen the damage. The best precaution is to keep these diseases well under control with regular checkups and a healthy lifestyle and medications if advised. Importantly, it is best to inform your doctor, your treating doctor, of all your medical conditions and what stage it is in, so that your glaucoma can be treated and the treatment can be tailored according to your existing condition.
And lastly, could you address a few myths about glaucoma?
Of course, one common myth is that glaucoma only affects the elderly people. In fact, it can occur at any age, even the newborns. Another myth is that if you don't have any symptoms, your eyes must be healthy. Unfortunately, glaucoma can progress silently without any pain or any other complaints, like we have discussed earlier. And lastly, some people believe that once treated, glaucoma goes away. The truth is that the treatment can only control the disease, but cannot cure or reverse the vision loss, or even cannot reverse the damage that the nerve fiber has undergone. Hence, regular follow-up with your eye doctor is essential to keep your glaucoma under control and preserve your vision.
Well, we hope this conversation has helped you understand glaucoma a little better and why regular eye checkups are so important. Remember, early detection can make all the difference in protecting your vision and your loved one's eyesight. Share this episode with your family and friends. Let's spread awareness about glaucoma. Until next time, take care of your eyes and stay healthy. For more information, follow us on @imattersdaily. Thank you.